Now, the last few months have seen the world suffer the emergence of some viruses and the return of some already known viruses. Ebola, SARS-CoV-2, that's COVID-19, the African swine fever, avian influenza, and so many more. So why are the viruses on the loose? That's a question we've invited virologist Dr. Michael Owusu to help us answer. Unfortunately, we still don't have him on the line, but we can discuss what we can do to prevent such viruses from hurting us. We're joined by the Deputy Country Director for SEND Ghana, which has been campaigning for government to adequately prepare for such unforeseen outbreaks. Thank you very much, sir, for your time here on Joy News Prime. Well, Manuel Cranton has a report before we go to the Country Director for SEND Ghana. Let's bring you that.
It's been 20 months since Ghana confirmed her first 2 positive COVID-19 cases. The impact of the pandemic has undoubtedly revealed long-existing gaps in health service delivery in Ghana. With 3 devastating waves in the period, the country's health system has been at the receiving end of unparalleled pressure, almost forcing it to the brink of collapse. At the seasonal peaks of each wave, the hospitals could barely handle the numbers. This is despite the unprecedented government expenditure in beefing up the country's health response. Official figures from the Finance Ministry captured in the 2021 mid-year budget review revealed that government spent in total of 10.4 billion Ghana cedis from March 2020 to June 2021. Monies for such spending were sourced from external sources in loans from the IMF and World Bank and internally from the contingency fund. Indeed, there has been private sector contribution in the construction and establishment of a 100-bed infectious disease center to augment the efforts of government, which had been largely on procurement and deployment of medical and other consumables like PPE, vaccines, reagents, and also implementing social interventions like free water and electricity at some point within the first wave. That left so much to be desired, at least for the researchers who were at the forefront of the country's knowledge gathering about the virus. This is because, as the cases went up, so did the need for testing of the most at-risk segment of the population, sequencing of the virus, and enhanced studies on the dynamics of the virus. Dr. Yaobediako is a research fellow at the West Africa Center for Cell Biology of Infectious Pathogens, WACPIP, at the University of Ghana.
I would say the research we are doing the best with what resources we have. We don't have a culture of research investment or investing in research in this country. Successive government, it's not just this government, in general, majority of the research in Ghana is supported by overseas aid. WACBIP was established through a World Bank grant. Our research is supported by funders including the Wellcome Trust, the Gates Foundation, the NIH. Noguchi is largely funded by the Japanese government. KCCR is supported by the German government. The research capacity in this country is largely dependent on grants that are from overseas. So we don't have much, if any, support for our research activities from our own government, which limits our ability to advance our research. So all that you see, the work that we have tried to do, the seroprevalence testing, the sequencing, is all funded. It's all money that we have repurposed from grants we had got to do other things. So we had grant money to study malaria, to do HIV work. When COVID came, we took some of the money that we had for those and we've applied it to COVID.
It is worthy to note that at the onset of the third wave, government committed some 800,000 cedis for distribution among the medical research labs across the country. Professor Gordon Awandare is director of WACPIP.
We are fortunate because we've been able to get some grants from external funders. Recently, the government of Ghana has made a contribution towards the sequencing. So they've given some money to Noguchi towards the sequencing. And we are looking forward to getting some of that support, which would help a little bit. It's not, it's not the kind of money that we need, but it's a contribution. It's in the region of probably 800,000 Ghana cedis for Noguchi, Wagbib, and UHAS to share.
But of course, this reality means that local information gathering about the virus was limited. Dr. Emmanuel Ahiable admits that this lack of information about the virus affected the confidence of medical response, and thus the lives of thousands of patients hung in a balance as they continued to battle to stay alive from one oxygen cylinder to the other. For those who were lucky to have been stabilized, they dreaded the experience and wished there was more that was done to protect them. With a cumulative number of 130,077 cases confirmed in the period beginning March 12, 2020, nearly 2 people succumbed to the virus every day, bringing total deaths to 1,175 as of October 24, 2021. Government has, through its coronavirus alleviation program, announced a tax incentive for persons within the healthcare value chain considered as frontliners. These included doctors, nurses, security personnel, and in fact, environmental health workers who conducted the burial of COVID-19 dead bodies under strict supervision from the Ghana Health Service. But these challenges were not exclusive to the COVID-19 burial team. At least, there were attempted strikes and threats of same from other health workers, including nurses and lab technicians. The relief for many health policy analysts is government's ambitious Agenda 111 project, which is expected to deliver 111 district hospitals across the country to significantly boost the infrastructural strength of the country's health system. An addendum is the objective of establishing local vaccine manufacturers in Ghana.
So, I hope that this event will highlight the need for sustained investment, government investment in research in this country. If we don't do that, the calls for why don't we have a locally made vaccine, in my opinion, are quite absurd because we don't invest in capacity. So there's no way, even though we have the human capacity, we have the human capital, there are people talented enough to do some of this work. If you don't give them the resources they need, they can't do it. So I hope that what comes out of COVID-19 is the realization that research is important. Research is a valuable investment. And it's an investment. You don't see the gains immediately. When you build a road or you build a school, within a year it's standing there and everybody can point to it. With research, oftentimes the gains are delayed. But you have to continue to invest in it because you don't know when you're going to need the results of the research. If we had been investing in research the way we should be over the last 15 to 20 years, we would have been in a position to develop our own vaccine.
Dr. Emmanuel Ahiable is a member of the Ghana Medical Association and the head of the COVID-19 response team at the Greater Accra Regional Hospital.
The number of cases have exponentially gone up the third wave. Because with the second wave, we're not having many patients, even at the emergency department, who have tested positive. But now, as I speak now, the COVID ICU is full. The isolation center, the holding center, which is supposed to be for suspected cases, is also filled with positive COVID-19 positive patients. And there's a spillover at the emergency departments who also have COVID, about 12 of them. So this third wave, which hospitals are overwhelmed, all our spaces are filled.
But ahead of the presentation of the 2022 budget and economic policy, Dr. Yaubidiakon of Wagbib believes a more robust path of sustainable funding must be charted to make this a reality. As the Christmas festivities beckon, the World Health Organization has warned that a fourth wave of the virus may be in the offing. The response to such an occurrence, especially in Ghana, will be dependent on the priority government places on epidemic financing through the 2022 budget. Manuel Granting, Joy News.
Let's go to Zoom now and speak to Dr. Emmanuel Efia, the Deputy Country Director, St. Ghana. Thank you very much, Doc, for your time here on The Pulse. We've seen all these viral, diseases ravaging our country, the continent, and indeed the world. From where you sit, have we done enough to prepare for large-scale outbreaks as we have seen with COVID?
Thank you very much, my brother, for the opportunity, and good afternoon to our cherished viewers. In fact, you do not need a prophet to tell you that as a country, we've not actually been up and doing as far as preparing for epidemics or pandemics are concerned. I mean, last year, we all here were hit by COVID. Even at the heat of the moment, we had a greater proportion of our population also dying from cerebrospinal meningitis, CSM for short. And this year, we are hearing, just last week, about 25 Ghanaians also died owing to yellow fever. At the time that we are still not so even out of the woods yet as far as COVID is concerned. The fact is that, yes, disease outbreaks are inevitable. They will happen. If you trace the history globally, we've had such pandemics happening. But what is important is for us to be prepared so that in the event that such things happen, at least we'll have ways to contain it. For us as St. Ghana, over the years that we've done budget analysis, we realized that as a country, although we have what is called a National Action Plan for Health Security, which is costed, the government has not really sort of devoted or allocated money specifically focusing on financing the National Action Plan for Health Security. And if we have such costed plan there and it's funded, that is where, in case of medical epidemics like that is where we have to take the money from. Following from the interview that you had with the researcher, it is clear that almost all our key research institutions that matter, the Noguchi and whatnot, are all funded by external sources. Goodness. And so the point is that if we wake up today and the external forces say that they do not have any money to give us, then what is going to happen to us as a nation? COVID came, yes, we had some voluntary mobilization of resources locally, but a chunk of it, if you look into our budget, the media budget, and even the current budget that was read, if you look at it, a chunk of it came from external sources. So for us, our concern is that it's about time that government try as much as possible, not looking outside, but inwardly to try and allocate some resources for epidemic preparedness financing. But today it is COVID. Tomorrow, we don't know what the future holds. It may be something that is more even grievous than COVID. Government indicated last year that Agenda 111, but we are not really seeing much of the Agenda 111. We thought that we heard, I think last week or so, that yes, plans are far advanced and they are put in place, but every time plans are far advanced, that's what we normally hear. We want to see action. Agenda 111 would not solve our epidemic preparedness totally, but at least it will help to some extent. Maybe let me add one or 2 points to it in terms of what government could do. Aside the fact that we are calling for government to still prioritize funding for epidemic preparedness, we know that the budget is red. The budget is there.
Exactly, really and I was just going to come to that.
Yes. So we are still analyzing, but so far we've not clearly seen any specific item focusing on epidemic preparedness financing. But that doesn't mean that maybe certain things done within the health sector may not go towards that. But we are of the view that it's very important. Government should have specifically focused on devoting some resources just for epidemic preparedness financing. We
Well,
think what could be done, even as we don't have much money, what could be done is being to broaden the COVID levy. That came last year. Last year, government issued a COVID levy. Maybe government should to broaden the levy to focus on general epidemic response. That will help. And there's also a call. We know that the District Assembly Common Fund, unfortunately, for the previous past year, did not really come. But there's a sense from citizens before the budget was from when we went trying that maybe we could also look at trying to get some sort of proportion of the DACF focusing on epidemic preparedness financing, and some of these things would help us.
But Doc, it's about the constraints, isn't it?
Budget line. Pardon, please, sorry.
It's about the resource constraint. You talk about the COVID levy, for instance. There have been, concerns raised about that levy and how counterproductive it is. You talk also about the, the resources that go to the various districts. That in itself is in arrears for several quarters. And so really there needs to be a sustained, source of funding to get this to work. Do you have any suggestions in that regard? Okay,
thank you. So we all do understand, we know that there's a constraint in terms of getting the needed revenue. Attached to GDP, we've always been saying it's around 13%. Government is trying to push it to 20 or so percent. I believe that is how come the 2022 budget, they came up with certain new tax initiatives to rope in more revenue. Speaking specifically to the issue at stake, the epidemic preparedness financing. Yes, we do know that, yes, already money allocated to health does not even meet the Abuja Declaration. But we have to prioritize